Hello, everyone. Thank you for joining me for this meeting. My name is Beva Poshkovic, and I will be presenting the rabies, and then that will be in the clinical setting. So we will be covering who is most at the risk, how the virus spreads, and what steps we can take to protect both our staff and our patient in the clinical setting. So who is most dangerous situation? Rabies can basically infect anyone, but certain groups face much higher risks. People who work closely with the animals, like veterinarians, animal control officers, shelter staff in particular, are vulnerable. In clinical environments like ours, children and people with weakened immune system are at the incredible risk, especially if they're like had exposure with wild animal or even straight animal. It's very important that we recognize that vulnerable population and take extra steps to protect them. What is the infectious agent? Rabies caused by the virus that is called Lyssa virus genus is transmitted most through the bite of infected animal. A risk factor include close contact with wild life, such as bats, raccoons, and skunk. Unvaccinated pets also could be a source of infection. And then one of the biggest danger in the lack of the timely post-exposure treatment known as the PEP. The earlier we act after exposure, the better outcome is from that one. Where should be testing done? So there's like two different ways. Testing done for the rabies depends on whatever we are dealing with, an animal or human. For animals, testing is done by the post-mortem on brain tissue. In humans, testing is much more complicated, must be done in a specialized lab using the samples like saliva, spinal fluids, and also skin biopsies. In our clinics, we don't perform this testing, just to remind everyone. Instead, we need to act quickly to report the potential danger to the local public health department for further evaluation. Then is infections window. So one of the challenges with rabies is long incubation period. In humans, symptoms can take anywhere from like 3 to 12 weeks or even longer to appear. However, once symptoms begin, the disease is almost always fatal. Animals may shed the virus even before they look sick, which makes even bite or exposure a potential emergency. That is very critical to use that PEP immediately. Why is the rabies important? So rabies is nearly 100% fatal when symptoms appear, but is also 100% preventable with early treatment. That's why it's very important to focus on the prevention. In our clinics, we need to protect staff through the training, through the vaccination. We need to educate our patient about avoiding like risky animal interaction and do our part to prevent potential outbreaks to the community. How to protect staff and prevent spread. Rabies spreads usually through saliva, like we mentioned earlier, typically from bites or scratches. To protect staff, we must enforce to use the PPE equipment when handling animals. High-risk staff, like those who work with animal control, should receive the rabies pre-exposure vaccine. If someone is bitten or scratched, immediately wound cleaning is medical evaluation are necessary. Basic disinfection methods like using a soap and a water, bleach, or even alcohol-based solution are effective, and they are like neutralizing the virus surfaces. Also, when we are talking about information and stuff like that, as you can see, the website CDC has more information on that one. If you are interested to read more information or get some more information, please visit the link that is posted on the slide. And thank you again for joining me and taking your time to learn more about rabies prevention. And then thank you again. I hope you have a great day.